So now let's talk about certain mechanisms of innate immune response. I'm going to start with inflammation as a general mechanism, and I will try to make it relatively short. So in kind of non-specific inflammation, so I have a blood vessel right here. Those are endothelial cells, okay? And then you have some kind of a damage right over here. So infection. Infection of the tissue results in the release of pro-inflammatory cytokines. That get into the bloodstream and eventually reach bone marrow. In the bone marrow, those pro-inflammatory cytokines stimulate leukocytosis, which is generation of many, many white blood cells. Those white blood cells end up in the bloodstream. Okay? Now, they need to recognize where the infection is. Am I clear? How can they do that? Well, it turns out that those cytokines stimulate the production of so-called adhesion molecules on the surface of endothelial cells near the site of infection. So adhesion molecules do exactly what the name suggests. They stimulate the adhesion, then rolling, so white blood cells literally roll in the endothelial cells. Eventually, they form this kind of flat-shaped, firm adhesion, and then they penetrate through the vascular wall in the process of extravasation. Another name for this process is diapedesis. Okay, so now check this out. Now, the white blood cell is about to enter the tissue. How does it know where the infection is? Well, it follows the breadcrumbs trail of cytokines. This process, as you may remember, is called chemotaxis. Does that make sense? Good? So leukocytosis, adhesion to the adhesion molecules, rolling, firm adhesion, diapedesis, chemotaxis, destruction of infectious agents. Now, what are the main players? The main players, not the only players, and I want to highlight it. So it's going to be neutrophils, and these are one and done. They die when they phagocytose. Okay, this is where pus is coming from, and macrophages. These are multi-use cells. Okay, we good so far? Now, if you look at this, all these different events, they eventually lead to 4 classic signs of inflammation. First of all, when cytokines are released, the vessels dilate to increase the blood flow to the injured site. And the permeability of the vascular wall increases. So dilation and increased blood flow results in redness, in Latin rubor, increased inflammatory processes and release of inflammatory prostacyclins, results in fever, local fever, or in Latin color. Increased vascular permeability leads to the leakage of plasma into the peripheral tissues, okay? Tumor and inflammatory chemicals and swelling, edema, okay? Results in pain sorry, I switched to Latin, results in pain, or in Latin, dolor. So if you want Latin, it's going to be rubor, color, well, it's not tumor here, it's edema. Tumor, dolor. Obviously, I'm not going to ask you to know Latin. Okay, does that make sense? This part. Okay, good. So we're going to kind of transition from this to another innate mechanism, which is phagocytosis, which is ridiculously simple. And I'm going to just lay it out in steps. I'm not going to draw a picture. So for phagocytosis, I've already mentioned there are, again, little digression. So, phagocytosis, for our intents and purposes, is mediated by these two cell types. Neutrophils die as the result, macrophages don't. So what are the steps? First is formation of pseudopodia by cells. Okay. Then we have engulfment. Okay. Engulfment results, so basically whatever is taken in gets in the phagosome. It's a vesicle. Then phagosome fuses with lysosome, forming phagolysosome. And then finally, phagolysosome results in the digestion of whatever was taken into a macrophage and a neutrophil, and exocytosis of debris. So the residue will be released. It's really a straightforward process. Does that make sense?
So it goes from phagosome to lysosome to phagolysosome?
Phagosome is just a carrier. Lysosome is a bag with chemicals. They merge, and these chemicals, digestive enzyme, hydrochloric acid, hydrogen peroxide, get dumped on the content of phagosome. Does that make sense? And everything that's there dies. Okay, we're good?